All right, thank you. So from global medicine, the whole body, to the engineer, and then to the chemist. So we're getting more molecular. I'll try to show you only a single slide of organic chemistry, how this drug is actually made. But the rest of the talk takes you through how these aminoglycosides act, because my lab works on RNA targeting drugs, and aminoglycosides are perhaps the most wonderful example of RNA targeting in the clinic. So we'll talk about plasmamycin in particular, because this is the newest aminoglycoside that came into the clinic about 2 years ago. Okay? So it's a unique story. It's a success and a failure story, both, and I'll talk you through that. Majority of the work with the aminoglycosides is funded by the infectious disease. Okay, so just a broad background. We all know we need new antibiotics. There is the fight with bacteria, but there's also the commercial aspect of the problems in new antibacterials is that they just don't make enough money, okay? So, and I'll allude to that constantly throughout the talk. But it's a big problem, not simply because of the cost in developing new antibiotics, but also the money we lose when we are spending time in the hospital treating patients that have infections that are very difficult to treat. So there's a significant cost to that one must consider as well. So the system is broken. You want a cancer drug, you would like a drug for blood pressure, Merck, Pfizer, they're all good to go. The simple reason is a new anti-cancer treatment or a new blood pressure medicine comes into the clinic and it makes a lot of money from day one. And we're looking at $700 to $800 million. A new antibiotic, 40 million, maybe 50, and even then we as a society tell the physician, hey, please don't use this unless the patient is really dying and you cannot use any other drug. So what does that do to the profits of the company? Shoots it down. So plasmamycin, the antibiotic, the newest aminoglycoside, that's a success story. It evades a lot of the resistance mechanisms that other aminoglycosides cannot get around. Yet the company that got it passed in 2020 basically filed for bankruptcy 6 months later. Okay, so that's the story of new antibiotics. Okay, so I mentioned to you that I look at nucleic acids, in particular RNA, and so there's a few antibiotics that are in the clinic that target nucleic acids, and the particular example here, we look at the macrolides, and the aminoglycosides are the one I'm talking about, that these target ribosomal RNA. The quinolones are really, they're looking at the enzyme part of the gyrase that looks at, that affects DNA cleavage, and then you have the beta-lactams that do not target nucleic acids. So the aminoglycosides fall in this one of 4 classes where we look at inhibitors of bacterial protein synthesis, right? So the aminoglycosides bind to the ribosome, that leads to mistranslation and eventually to bacterial cell death. Okay, so here's the father figure of aminoglycosides, Selman Waxman, who received the Nobel Prize for his discovery of streptomycin, which was the first drug for tuberculosis. So these were really the first treatments we had effective against TB in the clinic. And of course, now we have better drugs that we use for TB. Okay, so the ribosome. So here on the left is the RNA portion of bacteria. This is 4 billion years old, and as evolution of 4 billion years makes more complex species, Here are we. In blue, you still see that bacterial RNA intact. All we have done as we have become more complex species is that we've added more functions and added more pieces of the RNA. Okay? Why is that relevant? It's relevant because if you are to target bacteria and a microorganism and you want to kill them, well, you want to target something that's not going to change easily. So this is conservation. Ribosome mutations are quite rare. Ribosome mutations that really affect the whole process, ribosomal synthesis, are quite rare. There are cases that show up in the clinic, but for the most part, what this alludes to is the importance of the ribosome to all of us, starting 4 billion years ago to bacteria and all the way to us. So anything that targets the ribosome is actually going to evade a lot of evolutionary pressures and will remain a valid target for billions of years to come. Okay, so given that the ribosome is so highly conserved, you can see there's lots of antibiotics that bacteria have found fighting other bacteria. So the aminoglycosides come from soil, streptomyces that fights other bacteria, in the soil. So this is, these are your macrolides, and here are the aminoglycosides and the tetracyclines that bind to the small subunit of the ribosome. So it has the large subunit and the small subunit. So we'll keep zooming in a little bit into the structures of these aminoglycosides. They're broadly two classes where we have the central sugar, the deoxystreptamine, which is linked at the 4 or the 5 position, or which is linked at the 4 and the 6 position. Okay? So those are the broad classes of aminoglycosides. And these bind to the RNA. The problem, of course, with every antibiotic is resistance, and the resistant pathways are many. The one we're going to talk about with relevance to plasmamycin is the modification of the drug by bacterial enzymes. So what the bacterial enzymes do is they will take the functional groups that are present on the antibiotics, like the OH and the NH2. These are the only functional groups present in the aminoglycosides, and these are the ones that are required to bind to the RNA. So what do the enzymes do? Well, they'll react with these functional groups. They'll either put a big phosphoryl group, a adenine, or an acetyl group that simply take these polar groups and make them less polar and more bulky so that the binding site in the RNA doesn't fit. Okay, so let's look at plasmamycin in particular. Plasmamycin is it's a synthetic aminoglycoside that comes from cesomycin. And the difference, as I show here, is this 6' amino group has been modified, and this 1 amino group in ring 2 has also been modified. And what this modification do, both of these modifications do actually, is they prevent a lot of these amines and alcohols from being attacked by the bacterial enzymes. So I'll discuss that in a little more detail. Okay, so here's a bigger picture of the ribosome, and this is the 3' end, which is where the aminoglycosides bind. And we'll zoom into this part later in the talk. Okay, so that's the zoomed in part, a model piece of this RNA, small RNA piece. And this is exactly where all of the aminoglycosides, they have some secondary sites as well, but this is where they primarily bind. And I want to bring your attention to these two adenines, 1493 and 1492. These simply flip in and out upon aminoglycoside binding. Flipping out is ribosome on translation. Adenine's inside, ribosome off, or is fighting, doesn't quite know what's going on. So they really confuse the ribosomal machinery and lead to mistranslation and then eventually cell death. Okay? So this is the model RNA A site that we will look at for all our fundamental biophysical studies. Okay, so this is the only chemistry slide, but it's important because this is cesomycin, and all we're doing is converting this amino group and this amino group into modified amines and alcohols. Okay, so all we do is simply protect the rest of the amines and selectively convert those two into the appendages that we want for plasmamycin. And this is common in carbohydrate and sugar chemistry, is you have lots of similar groups, amines and alcohols. So if you need to make a change at one position, you got to selectively protect the others and then make the change that you need. Okay, so in collaboration with Berghuis lab at McGill University, they were able to solve the structure of plasmamycin bound to a bacterial ribosome. And as you can see on the left here, it binds very similarly, and I'll show you some other photos in the later slides, and it forms all of these nice hydrogen bonds with the bases of the RNA. So these are RNA binding drugs. They form nice hydrogen bonds and electrostatic interactions, which gives them the binding energy to interact with the ribosome. Okay, so here what we're looking at is these 4 drugs, which are all structurally related with minor differences with each other, and all of these overlaid in the crystal structure. So as you can see, there's a large amount of similarity between all of these aminoglycosides as how they bind to the ribosome. So very similar. The important thing I want to point out, so you don't miss that, look at these 2 bases, 1493 and 1492, they're flipped out. So all of the aminoglycosides, as soon as they bind to the ribosome, these 2 bases must flip out, and that's the miscoding in translation. Okay. Okay, so now let's look at the effect of modification on the activity vis-a-vis the bacterial enzymes. So because this 6' amine now has been modified, this modification doesn't allow one of these enzymes, which uses this amine group and converts it into an acetyl group so that it gets inactivated. That enzyme cannot bind anymore. Okay. The enzyme that reacts at this position also cannot bind, which is a little bit surprising, but this tail and this tail come together and protect this area from the enzyme, so they don't let the enzyme bind either. The other dangerous enzymes in Pseudomonas, Klebsiella, Acinetobacter, the phosphoryltransferases, and the nucleotidal transferases. Well, in the case of cesomycin and plasmamycin, there is no OH group here, which a lot of the aminoglycosides have at the 2' and the 4'. That's gone, so that's not a problem for plasmamycin. But this 2' still gets acted upon by the enzyme that goes after, so this resistance still shows up in the clinic. And so Berghuis lab also solved the crystal structure of the acetylated plasmamycin and looking at its binding. So this is the AAC 2' that takes this 2' nitrogen amine and puts the acetyl group on it. So what's remarkable in this structure is that this AAC 2' actually likes these two modifications that were synthetically made to cysomycin to make plasmomycin, it actually has a nice binding pocket for these two modifications as well. So plasmomycin cannot get around this enzyme. It's actually made for this enzyme in some ways. So once you end up acetylating at this position, now this amino group can no longer have an electrostatic interaction or a hydrogen bond with the ribosome, and so you end up with something like this. So it cannot really bind to the ribosome, but it fits in very well in the pocket of the enzyme that ends up acetylating it. So the energetic cost by losing that hydrogen bond and the electrostatic interaction is even more penalized by adding the acetyl group, which leads to steric hindrance with the RNA. So all of that put together, plasmomycin cannot bind the ribosome anymore if that enzyme is present, and no bacterial killing. Okay, so these were crystal structure studies. Now I want to share with you some of the data in solution and show you what different aspects of this binding that we can gather and what can we learn from this. I'll give you one of the key points up front. Of all the aminoglycosides we've looked at, plasmomycin is actually one of the weakest binders. Okay? So aminoglycoside binding, KDs, if you look at, go from nanomolar to micromolar. So this is in the low micromolar range. It's not a very strong binder, meaning you don't really need a nanomolar binder to have a wonderful drug. Plasmomycin, weak RNA binder, but still a wonderful, wonderful drug in the clinic. Okay, so I'll walk you through the biophysical techniques we look at is what happens when plasmomycin and the aminoglycosides bind to the RNA. They stabilize it, right? So we have a positively charged molecule coming in with a negatively charged polymer and binds to it. It means if you try to melt these, it's going to take more energy to melt the complex than you would simply the RNA, and that's what you see at different pHs and salts. You go from left to right. As you add the drug, it takes longer, more heat to melt them. As that's what you can see, the delta TM is the stability that the aminoglycosides impart on the RNA, okay? But the important thing I want you to note here is compared to cysomycin, which is in red, and plasmomycin that's in blue, if I can find my cursor here, the delta TM, the stability the plasmomycin imparts on the RNA is much lower than what cysomycin does. That's despite the fact that we've added two polar chains on the molecule. Okay. We look at CD spectroscopy, which is a global solution structure. These make no change. The flipping of the 1492 and 93 cannot be picked up by CD, so there's no global structural change. NMR spectroscopy confirms what we find in the crystal structures is that we see the NOEs that we saw with the 1490, 1406, and 1495. Again, the same pocket that's observed in the crystal structure. So very similar in that aspect. Chemical shift changes of the bases also confirm that the majority of the changes are taking place exactly in the pocket where the plasmomycin is supposed to bind. Okay, I'll skip this one. Okay, now what I want to share with you is the two bases that I talked to you about. The important thing is that these are both adenines. Those are purine. So adenine is a 6-aminopurine, but we can actually replace that in the RNA by a 2-aminopurine, which is fluorescent. So it doesn't change the structure of the RNA at all. The 2AP behaves, as far as the RNA is concerned, exactly the same, but now that fluorescent tag allows you to look at the impact the drug has on these bases flipping in and out. When the adenine is pointed inwards. It's stacked with the rest of the helix. So you're going to see quenching. And when the adenine goes out, you're going to see a change in fluorescence. Now, these two bases, 1492 and 1493, behave differently. So they're very unique in that aspect. Let me show you the major result here. As you can see, all the aminoglycosides, when added with the 1492 present in the RNA, the fluorescence goes up. Plasmamycin barely changes, and in fact, there's a slight lowering, barely a change here. Okay, we have to go to different pHs to observe that change. So that implies weaker binding. It's not really having a huge effect on that fluorescence. We can look at the lifetime of the 2AP labeled RNA upon addition of plasmamycin and cysomycin. And as you can see, you go from 1.5 nanoseconds, that's just the RNA, and cysomycin significantly enhances it. Plasmamycin enhances it to a smaller degree. And the same is true for 1493 as well. Okay, so the last part is what happens to the real thermodynamics, the delta H, the delta S, and the delta G of binding of plasmamycin and cysomycin to RNA. So something unique that I'll point out here. In all cases of different pH and salt conditions we look at, the binding is driven by the heat, the enthalpy of the reaction. In other words, as you can see here, these are large heats, minus 47, minus 60, minus 70 kcal per mole. As you go to higher pH, some of these heats are actually binding-induced protonation because the amino groups present at higher pHs are not protonated, but when they come in close contact with the RNA, they get protonated, and there's a heat involved with that. But regardless, it's still a large amount of heat for the reaction. And then we look at, obviously, they're not very favorable entropically here, right? So, but cysomycin, again, is much more favorable enthalpically compared to plasmamycin. We're looking at 47 versus 8. But look at the compensation. There is a big penalty for cysomycin. Again, there's a penalty entropically for plasmamycin as well, but it's much lower. Okay. If we look at the amount of electrostatic interactions both of these drugs form, you can take the log of the binding constants as a function of the salt concentration, and the slope of this line gives you the number of ion pairs that these form with the RNA. So plasmamycin forms 1 ion pair, whereas cysomycin forms 2, which makes sense because we're seeing more of an interaction of cysomycin versus plasmamycin. But by looking at the structures of these two, I would not have predicted that because we have more amines here compared to cysomycin in some ways. Well, this amine is not quite useful, but actually the same number of amines, but more flexibility. And what we find is that flexibility actually helps cysomycin, but does not help it enough to form strong hydrogen bonds. Okay, so here's a comparison of the crystal structure of cysomycin bound to the RNA and then plasmamycin bound to the RNA. The only thing I wanted to point out here is that if we look at some of these hydrogen bonds that are common, the length in plasmamycin is a little bit longer. So the presence of these two tails, the floppiness of these two tails gives a dynamic interaction to plasmamycin compared to cysomycin, so that the hydrogen bonds are weaker and the tails basically are not allowing the drug to bind as snugly. It's enough to do the 1492, 1493 flipping out, but in terms of the actual delta G, there's about a kcal per mole difference between the binding. Okay. So what we think is happening in terms of Why, if you look at the energetic cost, so let me point out here. Cecomycin, let's look at 100 millimolar salt, minus 73 versus minus 23. But if you look at the actual delta G, about 1 kcal per mole. So the entropic cost is being manipulated by cecomycin, and we think what's happening is that the tail, which is hydrated compared to the rest of the aminoglycoside, which is not very well hydrated in terms of ordered water, right? And the RNA also has ordered water. The drug binds, the water is displaced, but more water is displaced in case of plasmomycin, leading to larger disorder, and that helps its binding so much. Because if not for this entropic help, plasmomycin would not be a useful drug because its binding would drop, 10, 15 kcal per mole, and then you got nothing left. So, in summary, right on time, plasmomycin binds very similar to the rest of the aminoglycosides, but a much, much weaker binder. Binding is enthalpically driven, but the tail, actually the hydration of the tail, helps it enough that it has the binding contribution needed to be an effective antibiotic. And these are the people that did the work, Bergquist Lab that solved the structures, and the NIH for the funds, and thank you for your time.